Minister, in March 2021 I asked you a PQ specifically in relation to gynaecology waiting lists, and at that time there was 30,180 women waiting on an outpatient department appointment, not including inpatient, outpatient alone. Now, in your reply you referenced the impact of COVID. However, Minister, at that point there was 8,223 women waiting on appointments since before COVID ever came into existence. In recent weeks I asked you the same question again, and despite your reply last year, this reply showed that the waiting lists had not just stayed static, they'd actually increased to 30,805 women waiting on an outpatient apartment. And I really am glad that you referenced women and girls in your reply, because 293 of those 30,000 are actually with the Children's Health Ireland Crumlin. Now, Minister, I'm urging you to act now and to end these long gynae waiting lists. They are spiralling. And I've said in this House before, and I will say again, we are creating the perfect storm when it comes to women's healthcare. No woman requests a gynae appointment on a whim. It's done because in often cases debilitating symptoms and that need urgent medical care. Abnormal bleeding, fibroids, endometriosis, cysts, prolapse. Behind each and every one of these 30,805 figures on a waiting list are real people with real stresses, real concern and a real medical need. Delayed appointments and delayed care results in delayed diagnosis and delayed treatment. It's not acceptable, Minister. Women deserve better. So my questions to you today are this. How much of the 350 million of the waiting list action plan will be allocated directly to gynae services? And will you publish a specific plan for gynae care to ensure that services across the country, because there is not one area that does not have a significant number of women waiting on this medical care, ensure that each and every one of those services is sufficiently resourced to reduce these waiting times down? Because failing to address this problem now, which has increased in the last 12 months, is continuing to fail each and every one of those people on that waiting list. And women deserve better, Minister, and they are expecting government to deliver.